My sophomore year of college, I tore my ACL playing lacrosse, season-ending injury. It was a big deal for me. The PA came in, he saw my knee, and he was like, that is very swollen. He did one simple procedure, and I was able to walk much better. And I was like, he's not the doctor, but he's a high-level medical care provider that did one simple procedure to help me feel so much better, and I was so drawn to that.
Seeing my family members grow up and live life not making the best decisions as far as health goes has been with me, and it ignites my fire to pursue a career in public health that helps us create policies and helps us improve our community to where we can all be better as one.
I became interested in art therapy because I have a passion for serving the community and a passion for art, and art therapy perfectly combines the two.
I definitely do feel like I have a calling for surgical assisting. I remember in high school, I'd always wanted to be a surgeon. I've always wanted to be involved in surgery. The OR always attracts me.
All of our students, to some extent, really do have a calling, and the calling is to help people. And what we try to help them do is build on their strengths and find the most effective way that they can fulfill their vision of helping as many people as much as possible. Eastern Virginia Medical School is a small graduate institution. We have a School of Medicine. We have a School of Health Professions, and over the years have added a variety of programs to train people to work in the health workforce to supplement the capabilities of physicians. Everything we do is at a graduate level, either in a master's program or a doctoral program, and it's oriented only to health and medicine. But we're also heavily engaged with the community. Our vision is to be the most community-oriented school of medicine and health professions in the nation. We take that very seriously, and that's a distinctive part of our education.
So students that come to the School of Health Professions obviously are focusing on their individual program, but they're actually part of something bigger. Eastern Virginia Medical School has a very highly regarded name in our community that will continually serve our students throughout their professional careers.
I chose the PA program at EVMS because I was really drawn to the community focus. I didn't find that at other programs, and I have been volunteering my whole life, and giving back to the community is a passion of mine.
Everything that EVMS really does is focus on the community. And when students come here, they have a wide variety of options to get involved in the community.
And the way that our students do that is to engage in different projects that relate to either service or advocacy.
That can improve the life of our children, improve the life of our neighbors, our friends, our family.
Health disparities is a very important issue, and our school is much committed to address the health disparity issues.
However, healthcare really is a team sport. And what I mean by that are there are professionals that are in the background, there are patient interaction professionals that are not clinical, and we train some of those professionals that are very important.
Patient care comes in a holistic fashion, and it's not just the bedside component of it, but it's also what comes out of the laboratory and what type of diagnostic elements come out of that laboratory that are going to dictate the clinical management of that patient.
In the School of Health Professions, the Art Therapy and Counseling program serves the need to address holistic health and the area of mental health care. And so we are one of the few programs that directly addresses mental health and the mental health needs of our community.
Because it allows for utilizing visual practices and creative practices for healing and wellness and processing information in a different way.
And so we have programs at EVMS, but the unifying factor is we're singularly focused on trying to meet the needs for the healthcare workforce for the 21st century.
We're here at EVMS are preparing the next generation of healthcare providers. These are really crucial to making sure that we have healthcare providers who are ready to face the challenges for the next generation and beyond.
Students come here with dreams. Every time we look at their essays when they apply here, there is not one that doesn't touch on somebody in my family or a dear friend had X or Y health problem and disease, and we would like very much to contribute to the cure or advancing treatment. So they come on board with big dreams, and we try to nurture those.
40 years ago, no one knows there's a job called embryologist, but now this is a very important clinical professions in the reproductive science, and we're so proud to be able to provide this embryologist for tomorrow.
And the only way that you can provide the care that your patients or your clients need, you have to involve people who look at things differently than you do and develop a more holistic perspective. And that's one of the major reasons from the beginning that we've emphasized diversity and inclusion, because we understand people don't exist in a vacuum and there isn't a singular way to describe clinical problems.
It is the most diverse student body I have seen. And it's diverse in every way you can think about it.
I mean diverse in terms of their background, so socioeconomic status, as well as their career status, and then when you get into gender, race, all of those different factors, it's important that we consider that in our students and that we embrace that as part of our learning community.
Our interview process, we get to know our students beyond just what their transcripts say. We take a very holistic approach to our interview and bring that to the healthcare field, because those are the type of professionals we want to have in the operating rooms or in the doctor's offices, taking care of the patients.
This is really important because within the healthcare arena, individuals are going out to different communities and training with people from different backgrounds in order that they can have different perspective and know how to interact, relate to individuals who may not look or be like them.
So there's great value in getting your education here at Eastern Virginia Medical School and the School of Health Professions. We are connected to a medical school and we exist on a medical campus.
We see it with our alumni that they are getting into much better positions, actually faster than they thought they're going to get into it.
Our connection with our alumni has been really great. Over the past few years, we've been cultivating our alumni to come back to campus and do special lectures, develop skills training, involved in the curriculum itself.
The job placements for the Path A resides at 100% job placement. And same with the histotechnology. When we look at our alumni feedback, say, hey, we're happy with the jobs that we have. What an investment I have made. I am so glad I went here.
So increasingly in the 21st century, higher education has moved to kind of a blended format using online technologies.
You know, we offer a lot of programs and various delivery modalities. So some of our programs are 100% online, where you work at your own pace. We also have hybrid programs where you have both a in-class requirement and a online requirement.
Online courses in the School of Health Professions provide access to education for students who can't just pick up and move and come to school full-time.
Yeah, I'm located in New Orleans, Louisiana. The online classes have been really nice for me because I can kind of log on and complete my work whenever I have time to. This virtual program allowed me to stay in the role that I was in, as well as kind of advance my career.
We have some unique assets here. Our library is not only a traditional library with books on shelves, but is a learning center with a huge amount of access to digital resources. We have a simulation lab that's among the most comprehensive in the world. It is in fact used as a model from Singapore to Taiwan to Norfolk. And so I think students who come here find a very supportive environment and have access to all of the 21st century study aids they need.
I've been working towards my goal of becoming a PA, and now that I'm here, I'm so happy. I can't wait to be able to do those little procedures just to help make a difference in someone's life.
And with public health, improving our communities, finding policies and procedures and creating policies and procedures. And that to me is why I became most interested in public health.
I definitely feel that EVMS is preparing me to be the best healthcare professional that I can be.